16 pounds.
Wow.
Times 4, it's 26.
Okay.
16 times 4 is 26.
Chiro
School. Here,
Richie.
you do that, and then I'll
Okay.
make the sound. You do
All
the
right.
Spinal Tap.
Welcome to episode 10 of Spinal Tap.
Dear girl, I am a doctor. Doctor.
These go to 11.
Wait a minute, Doc. Are you telling me that you built a time machine?
Did we just become best friends? Yep.
The skeleton ran out of shampoo in the shower.
1.21 gigawatts! This is a house of learned doctors. You're not a doctor.
Episode number 10, and we have some special guests. Our mustaches. Let's give a little shout out. Yeah.
We kind of have like the 3 phases of mustache regret.
Where?
You're one.
Oh, come on.
He's 2. And I'm like, full on, please be gone.
How can I hide this? Anyways, we have a special guest, Sue Goehl-Manolis, a.k.a. Sue Hemme, a.k.a.
We should probably get a nickname for you.
a.k.a.
That'll be fun. See what you come up with.
Probably.
No, but we have, we could take up most of the time just talking about your credentials, of course.
You just want to screenshot?
Yeah.
Just do a quick one.
We'll
of
just
these?
do a quick
Just
snapshot.
roll
Yeah.
it.
Star Wars. Fade out to the...
You're a nurse practitioner.
I
is
am.
number one, and you've been in practice for 33? 34?
33, yeah.
33 years, yes. 33 years, which is awesome.
It's how old we are.
Yeah.
Well, that's a good thing
Wow.
to flatter a guest with.
Thank you.
Yeah, I love it.
You're welcome.
I'm a dinosaur. What do you got?
I'm a baby.
Okay.
See my head?
I think it's more than a coincidence that we were born the same year she started in practice. I think it's...
Oh, that is
There's
kinda
something
cool.
about that year that was just magical.
We were...
Meant to be?
There's some reproductive health topics happening when you were getting started.
Yeah,
And your parents are getting started.
that too.
Gross.
Yeah, anyway. So, Sue is a nurse practitioner and now new owner of Conceivable Fertility and Wellness, LLC.
Correct.
Zach, where does she do her business?
She does her business alongside Midwest Chiropractic and Wellness.
Right here in your amazing space.
In our amazing space.
I had debated med school. My dad was an OBGYN, and he was 100% against me going to medical school, just saying, way too political, way too regulated, not fun anymore. You only get 15 minutes a patient. You don't have your connection. Don't do it.
Yeah.
I'm like, that doesn't sound fun.
Yeah.
I'll go the nursing route. So
Okay. Cool. And then from there, after Gustavus, where'd you go to? Where'd you go to after that? Did you do
after
it all?
that, nurses have to work for at least 2 years before they can go into nurse practitioner school. And at that point, I was not on the NP radar. That wasn't something that I was pursuing. So I landed my dream job of working in the newborn ICU as a nurse. Thought I would live there, work there forever. And then things just shifted, went into labor and delivery. That's where I learned the fertility world. And then went into clinics from there, into an OBGYN clinic to learn more about infertility, and then was recruited from there into a fertility center so I could start their donor egg program, which in the mid-90s was very cutting edge. So it was fun being a pioneer in that. Sorry to cut you off. I have a question. So you said when you went into labor and delivery, that's what got you passionate about the fertility. Yeah. So that seems like obviously labor and delivery is like the end product. And then it shifted your passion to fertility. So is that a common thing? Like how did that come to be? No, one of those luck of the draw kind of things. But at the University of Minnesota, the fertility program back then used the labor and delivery suites for the egg retrievals and embryo transfers. So I was assisting in those procedures and was just like, wow, this is fascinating. How do these meds work? How does the science work? How does this all fit together and the protocols? And so, yes, I started baby. I went to delivery, and then I went back into sperm and egg, and that's where I've stayed the rest of my career. So, shifted gears, went into the nurse practitioner program at Planned Parenthood, and After I graduated from there, I went back into an OB practice as an NP then and started their fertility program, ran that, did general OBGYN for patients, and then shifted, did nationwide fertility education, shifted again back into an infertility clinic, was there for a decade, loved it, and then pandemic hit and decided I want to do telemedicine. So shifted into telemedicine, which was actually a super great opportunity for me because then I started doing male fertility instead of almost my entire career had been female fertility.
You know, male fertility, especially, and I think it's something that's so unrecognized and forgotten about and just like never put into the equation that I'm like, oh, sweet, tell me more. And then our conversation just kind of went from there and you're like, oh, I've been thinking about starting a podcast. I'm like, well, I'm like, we have one. You should be a guest. And then from there, it just kind of slowly grew into now you being here, which is awesome. So my question is, you know, what gave you a focus to get into like male fertility versus focusing only on female? Was it because there's already such a wide array for females and there's just nothing for males, or where did you see that gap?
The gap, in my experience, professional experience, it was almost completely focused on the female. We got a semen analysis, maybe 2, and it was purely to see, are there enough swimmers to do timed intercourse? Should we shift them to intrauterine insemination, or did they need to do IVF? And that was it. It really wasn't, why are the numbers low? What can we do to improve the numbers? What can we do to make the sperm healthier, to give better fertilization and embryo quality and pregnancy rates? It was just, do you have enough? Okay, good, we're good.
So it's just a numbers game. That's
It was,
basically it.
yeah, a lot of fertility treatment is just based off of the numbers game because fertility centers are reproductive endocrinologists or OBs that have additional fellowship training in female infertility. Very rare for a reproductive urologist, which is the male fertility specialist, to be in a fertility center. So in fairness to the reproductive endocrinologists, that their focus is on the female, and we just have to make sure we have enough sperm. So in doing the telemedicine for the last 3 years, it was really eye-opening to me of, one, how many guys care about what their numbers look like. That, you mean I can do something to make these better? You mean, oh, this is contributing to that? And wow, I want to make some changes. So it was great for that. And then also just the more simple step back of, well, how do we even know when to have intercourse? How often should we have it? What's the fertile window? How do we even... And it just raised that awareness for me that so many people, you know, we're all taught how not to get pregnant, you know, but not how to get pregnant.
Jeez,
And
middle school was scary. The 6th grade, we started learning about that, wasn't it?
6th grade?
Yeah.
Yeah.
Yeah, that's when people started smelling bad. Like puberty was hitting.
Free
their most,
deodorant.
and-
Hey, free deodorant was
Yeah.
supplied during those classes.
Yeah.
Just
Yeah.
some Old Spice. I can smell
Oh,
it.
yeah. The
Oh,
blue
yeah,
gel.
the blue gel.
The stuff that definitely caused fertility issues.
Yeah.
Boy,
Put this down here.
geez,
Oh,
coach,
God.
my balls are really on fire.
Oh, yeah.
Poor
You
Coach
s- yeah.
Laney. That was a good side quest.
What were we saying?
Men's fertility.
Men's fertility.
like
was
sperm
overlooked.
counts and whatnot.
Like how
Yeah.
people are taught so much how not to get pregnant.
Yeah.
yeah, and how many steps that can be taken to improve fertility before you even start trying, or to just assess what's your status before you start trying, and then you can make those changes and maximize your attempts once you do start trying.
Well, I think we should talk about those. What are common things that you see with males that's a big roadblock for them to have the appropriate numbers?
That's a good question.
Maybe stress. I mean, you can narrow everything down into stress ultimately. But is it nutritional stress? Is it emotional stress? Is it work stress? Is it like what? Because along the way, along the path, you had to somehow come to a realization that like, something's going on that's causing these bad numbers. And what was that for you? Or what have you found through your experience?
Yes, stress is a big part of it. Changes cortisol, decreases testosterone, decreases production, all kinds of ripple effects, as you were saying. And then diet, where and what we're eating and where the food sources are coming from, and all the plastics, as I'm sitting here with a plastic cup in front of me.
No judgment.
Just switch that glass bottle.
Hopefully it's BPA free. But what's in our environment. So much is environment. Our food, fast food, processed food, convenience food, packaged food, restaurant food, all of that is containing things that are not the best for our bodies. So it is food, it is exercise, it is being more sedentary, it is more sitting for jobs, and lots of those contributors. Another contributor is marijuana, and legalized in many places, and yet
Marijuana.
it definitely contributes to fertility, male and female.
How quickly? Like
How-
instantly?
Instantly.
Whoa.
Yeah.
And why is that? I mean, like, what's the reason? Why does it interfere with that?
Testosterone?
Testosterone.
It just decreases the testosterone?
Yep.
Yeah.
So production, and it also impacts the integrity of the sperm. So the health of the sperm themselves with their DNA package inside the head. So there's
But
a lot
not cocaine. That's cool, right?
Yeah, what drugs are...
No.
Quick switch.
Any drugs help?
Nope. There are those patients that are like, can you actually write me a prescription for cocaine? Because it seems like anybody that takes cocaine gets pregnant like that. But doesn't quite work like that.
That's a real conversation you had?
That's a real conversation.
Oh my gosh.
Oh, amazing.
No.
Yeah.
So, in that
Go ahead.
vein, like, all these things are hindering someone's ability to produce good sperms. Is there, like, a bang for your buck type of thing? Like, something that people could focus on, like, do these couple things and, like, what time frame, too? Because I'm sure a lot of people are like, well, if I make these changes, how long do I have to keep it up to... Oh,
Can I just make
ran into that one.
a quick cliff note?
Yeah.
The amount of innuendos in this
There's gonna be a lot.
podcast, I mean,
Well, he
let's just
said-
lean
There are
into
plenty.
it. Can you
He's like,
accept
in
it?
the
I'm sure
main-
your life is
Full of
full
them.
of it.
Yes.
That's
like in
fun
the
for
same
you.
vein.
Uh,
Keep it
the
up.
main vein. Okay.
Yeah, the keep
All
it
right.
up one was that. So how
Yes.
long
Thanks
does
for your
one
entertainment.
need to maintain these things to see a significant change? Like, we get that question when people come and work with us for physical ailments, like, oh,
Low back.
can I come in twice and be fine? We're like, probably not. But, there is a time frame that we can reference. Is there something like that in your experience?
Yeah, so for men, sperm are generated every second. Essentially, about 1,000
We're
sperm.
working real hard.
Over 1,000 sperm cells are kicked into the testes every heartbeat.
Yeah.
Wow.
Ladies just do a
But-
few every once in a while.
Doesn't it take
Yeah.
like 70 days for them to mature?
But then, yes, they need about 72 days to mature and then make their way out. So it's about a 3-month process, but you are making new sperm every second. So changes that you make now are going to benefit what you are maturing. And true assessment would be 3 months from now to see what you change today. What's the full effect?
And from clinically, is that what you, when you're giving recommendations to males, are you like, hey, you're going to make these changes, come back in 3 months and we're going to retest?
Yep.
Right.
To look at an
Because
analysis.
those new sperms
yes.
are ready
Yeah.
to go at that point.
Yeah.
Sorry, I cut you off.
I had a question about there's a sperm. It's, what factors are you looking at besides the count? Because there's different things, like you said, DNA package and what that is. Can you
Dumb it down.
dive into those?
Dumb it down for me, please.
Yeah.
Sure.
I don't know.
What makes a good sperms?
I'd love to. Yeah, so a routine semen analysis is going to look at volume, how much ejaculate volume is there, what we call the concentration, that's what people think of count, or that's how many per milliliter in the millions. How many of those sperm are alive and swimming well, and what % of them have normal shape. So all of those things are put as, with equal weight to see, because they each can represent something else that could be contributing.
And just for reference, because I think the just general population doesn't know a normal count of semen that you should have. Can you reference that?
So there are 2 different ways that can be reported. There's something called the total motile count, meaning how many million sperm are alive in that entire ejaculate. And that's one piece of how it's reported. It's also how many sperm are there in the millions per milliliter. So there's 2 different on that. So the total motile sperm count ideally would be over 40 million per ejaculate.
Jeez Louise.
And
that's a lot.
Yeah. And World Health Organization sets the reference range of wanting to see at least 50.
Who's that?
Who?
Oh, myself.
Bunch of dickheads.
That was a good one.
Richie, that was...
Who said?
Cut it out.
Who said that? Just cut it out, all out.
I will. Don't worry.
Okay, go on.
So the reference range, 15 million sperm per milliliter is the bottom. That's the 5th percentile, but that's what patients will see on their report. And they'll think, oh, great, I have 16 million, I'm in normal range. But ideal or typical production is more like 50 to 70 million per mil.
Does that wane as someone ages usually?
It can.
Yeah.
And
Does
it can
it go up?
Primarily because of testosterone.
Oftentimes, yes. But there are many things that contribute. And so guys that so commonly now are at all these pop-up men's clinics that start on testosterone replacement.
Does it go up?
Goes down. It goes way down.
Why is that?
Because
not
it's
making
the
your
same
own.
concept.
It's not making your actual testosterone.
Right.
You're just
It's putting your testes on vacation, just like birth control pills put ovaries on vacation. The body runs off of synthetic.
Yep.
And many men that I talk to, they're like, nobody told me that.
Right.
They're thinking, hey, I feel great. I have a better sex drive. I'm stronger.
jacked.
I have all these things.
Yeah, let's do it.
And they do an analysis, and sometimes they're completely bottomed out to 0.
yeah,
Whoa.
which is unfortunate because that should be like within the
And that's
informed
swimmer.
consent
That's
somewhere,
like,
too.
that's sperm count to 0. Interesting.
Can I ask a quick
Yeah.
question? Of those three, of those three that you mentioned, shape of sperm, volume, and
Motility.
motility.
Mo-
Mo-
yeah,
mo-
motility.
Like the tail wagging.
Yeah.
It's
Okay.
alive. Yeah.
Yeah.
So all three are equally important. So
They're all important.
is there? I mean, can you put and say this one is king sperm? Like,
There's debate about the morphology or the shape component of that and how much that really plays in. Shape is determined by a number of different things, but a normally shaped sperm doesn't mean that the DNA package is normal inside of it. So it looks normal. It might be swimming fine and everything looks great, but it may still not have all the components within it. What brings down shape is can be all these external things, diet, exercise, lifestyle, but mostly with chemical exposures. That's where the marijuana, the cocaine, or any other drugs,
How about glyphosate?
alcohol, all kinds of things.
Roundup.
Yeah,
All
Just
these
really
infertile
fast.
farmers.
all kinds of things.
Ton
So
of things.
Yeah.
Well, because yeah, all those things ultimately, the sperm needs to. It has a finish line, and it doesn't take just one to complete the cycle either, right? I mean, I don't remember the number, but it's like you need a couple hundred, a couple thousand, a
Really?
couple 100,000 to reach the egg to break away the plasma
oh, you
surface
gotta
to.
need to be
The
construction
key.
Right.
workers
Yeah, so it's
like
not
that.
just like one; it's a team effort, right?
There's some
a team
sacrificial
effort.
lambs there.
exactly.
Yeah.
Come on, boys, we're all dying.
Yeah.
I
Yep.
based all my
Yeah.
conception knowledge on the Look Who's Talking movies. Where it was just that one.
I'm in.
Yeah. That's everything I know about babies.
Yeah,
I have a very side
Yeah.
quest question.
Yeah.
Have you ran into like the female being allergic to the semens?
That was a thing that came about in
It was
the
kind of like a hot
90s
topic
maybe.
for a bit, wasn't
Yeah.
it? Like, I'm
All
allergic
the-
to my husband's semen.
Yeah, all the immunology component and a lot of that
that's
fell
not
by
really-
the wayside.
Okay.
Get out of here.
Evolutionarily, that seems like a very rare thing, like a bad idea. to
Yeah,
have.
some believe in it, some
Yeah.
treat it.
Sure.
It's not commonplace
God,
by
that's kind of
any
cool.
means.
I like that. Like, that's not true. Get out of here.
Yeah.
And that's so
Yeah.
much of it. There are so many myths that float around out
What are
there.
your favorite myths?
Yeah.
Oh,
Myths.
Come
favorite
on.
myths.
Top 10 myths.
I love it.
Dave Letterman style.
It's a content.
Oh, a
creator's
good
dream.
myth, a common, what men think is, well, I'm just not going to drink while my wife's in her fertile window. And
Drink
that's going to help my
alcohol?
fertility. Drink alcohol. Yeah.
That's boring.
And
Don't do that.
it's like, nope, it's that whole 3-month process. It's everything you do in that window that leads up to that. So that's a bit of an eye opener. Guys think, I make new sperm every day. So it's just today
Yeah.
that matters.
Yeah, but
Yeah.
they're getting stockpiled and growing somewhere, right?
What about the tidy? It's the tidy whitey. Is that a myth, or is that there's a lot of
Briefs
validity?
over
that's a good.
boxers.
Yeah.
That's a Seinfeld when Kramer
Yes.
switches,
Yep.
and then he's not wearing any underwear. And Jerry's like, "Do you realize it's between us and him is a thin layer of clothing?"
It's dangerous.
But that's a good question. Yeah.
It is a good question. And there's mixed answers to that, but reality is scrotal temperature matters. Testes are outside the body for a reason. They like to be a couple degrees cooler. And if they don't have that option and they're always tucked up, that's going to impair. So that's where sitting all day, computer programmers or the pandemic did
Social
a lot
media.
of that. Social media.
Wait, now I stand. I have a standing desk.
Laptops.
Yep.
Laptop.
Oh yeah, it's frying
Frying
eggs,
them.
frying sperm.
What other possible myths are there? Go ahead.
Big Lebowski. Remember when that gal was?
Oh yeah,
She
what did
was
she do?
upside down.
Upside down.
Oh yeah.
It
Positions to get in
gravity.
post coitus.
Yeah.
during coitus as well.
And during, that's,
Is there any
Pretty much.
viable options?
Gravity
Yeah.
doesn't work in that nature.
yeah. A lot of women think that all the fluids that then leak out after intercourse are like, oh my gosh, there goes all the sperm. And a lot of that is just the female lubrication. Sperm are tucked way up at the top of the vagina, right by the cervical opening. So,
The green berets.
yeah.
Come on, man.
All
Like a
those,
bunch of paratroopers.
Go.
I see the beach. It was Veterans Day a few days ago. Thank you for everyone's service.
Yes, thank you.
thank you for everyone's service.
Well, even on
Absolutely.
Segue.
yeah, that is. Thank you.
We got
The
that point
opposite.
down.
So maybe even the opposite of that. People trying to prevent fertility. The opposite is correct. If that happens inside of you, and then you try to get rid of it,
What
it's
happens
not
inside of you?
necessarily accomplishing it,
Right.
right?
That is true. Ejaculate
did
is
you
a
have-
tiny amount.
Stop it.
Half a teaspoon is normal volume of ejaculate. So
Yeah, what's average? We gotta go over all these averages now.
You got a little notebook over
That's
there?
just taking notes, yeah.
I'm okay.
That was the original joke I was gonna start with. So what's average? I had a question. So the tiny little amount, because with Michaela and I, with our third try, like our third child, that was actually the hardest one. Like we had to put effort into like timing, and she's like, "Now or never, buddy." And I'm like, "I'm tired." But that ovulation window is a certain day. Like you need to start, inseminating the area.
The area? What are you spraying crops?
Yes, it's like a crop field. But like you want to plan ahead and have samples in there. Let's say how many days? Like a week before the ovulation window, or what's the?
no, a lot of that depends on how her cycle timing is. If she's very predictable, that window is a lot easier to see. But most importantly is having sperm there ready and waiting at least a couple of days
Right.
before that earliest
And that was
ovulation
kind of
date.
like our aha, because we were like ovulation's here, and then we were told like no, a couple days before people. I'm like sweet, let's go.
Yeah,
Things
and
you
that's
learn.
because sperm live 2 to 5 days in the female reproductive tract, but the egg's only good for 24 hours.
Crazy.
So if there aren't sperm there saying, "Hey, we're waiting for the egg," and the egg pops out, and there are no sperm there for 24 hours,
It's crazy. how
there's your month
frickin-
try.
So,
It's-
like, if you
jeez.
hit that window right at that time, though, theoretically, that should be like if the egg's there and new semen is produced for the taking, if you will, that can happen.
That can happen, yes, but likelihood depends
Georgia
on
was
the age.
like one and done. That was terrifying.
Yeah. Everyone's the same. Like, oh, okay, we're doing it now.
We have a child,
Yeah.
but Wendell was tough. Not tough, but more of an effort. How were your children conceived quickly?
Well, Poppy took some time, and then Parker was quick.
Parker was like, "Yep, we did it
Yep.
again."
Oh, dang it.
Like a Britney Spears
Here we go
song.
again.
All right.
When you told me, I'm like, "Oh man, that's fast."
Yeah. Yeah, 15 months apart. So, yeah, so that's a lot on the male side of things. Anything else to add that people might just not know? That's just good little tidbits, clinical pearls.
I mean, there's been so many already.
I know.
There have been lots, yeah. It's
More, though.
really one
Loads
of those.
and loads of information.
Were you up all night just thinking
Hit
of
the
these
walls.
little
That one
one-liners?
just came right.
Don't you know him by now? It's just constantly, both of them.
Yeah,
are
that's all he thinks
That's
about.
all it is. Just sperm jokes. This is a wet dream for you, isn't it?
Yeah, wet dreams.
That's
Crazy.
a whole. I'd love
Let's
to
talk
hear
about
that.
those.
Let's talk about the profession of conception.
Yeah, let's do that.
Let's talk about the female side of things.
Well, one last little pearl,
Yeah.
and this segues for both male and female. It's really to lead your life like how you were taught when you were small. Eat your fruits and vegetables, take your naps, get outside and play, sleep well, de-stress, connect with others.
Yeah, that's hard to do for some
Take care of your
people.
body. It's
The
very hard.
de-stress part.
It's very hard, and it's a big contributor.
How do you, as a professional, how do you offer, what are some things that you tell your clients when they're dealing with this? Like, hey, for 3 months, chill the frick out. Like, that's harder said than done.
Right, and that's not usually very helpful because they're like, then they stress out about I need to chill out and I can't.
I need to calm down.
Yeah. So it's find those things that bring you joy.
Yeah.
Yeah,
and,
there you go.
And that's different for every single person. Is it going out in nature? Is it doing a calm app? Is it doing meditation? Is it holding hands? Is it, whatever it may be, doing a craft, whatever
Smoke
brings
some
you.
cannabis.
No.
Nope.
Oh, yeah.
Don't recommend
do
that one.
Cocaine.
No,
No, that one.
not that one either. I've really worked with the whole gamut. I love the beginning stages of just the wow. I mean, even in this podcast, you guys are like, wow, I didn't know that. And
Yeah.
the things that you learn and just helping people be more in tune with their body and what they're doing, what their choices are impacting their health and down to their fertility. And it's getting out there. Another myth sort of that you brought up was how many women are told if they go in for their annual exam and they say, yeah, we're thinking about starting, and the general advice is we'll go off whatever birth control, and if you're not pregnant in a year, come back and see me. And women go off their birth control pill or whatever it is, and maybe they have irregular periods, and they think, well, that's kind of normal for me, so we're just going to keep trying, when intervention could have happened way before that year, or checking the sperm way before that year. The average time of a male being assessed is 22 months
God, that
into
just seems
fertility.
like such a missed opportunity. Holy
Right.
moly.
Right.
So if I was a new couple that want to conceive, and how much time would you say should pass before they come and see you? Like a year
Yesterday.
of trying?
Yeah.
Don't
None.
even.
No need to wait.
As
let's
soon
go-
as you
let's
leave your
talk.
OB.
Yeah, or a family
Yeah.
practice,
There
or
you go.
when you decide,
whatever.
or when you're thinking about it, because then I can just say, here are some things to work on. Here's just some awareness.
And I think that's,
Yeah.
the value of what you provide is, because people don't know that they're like, well, I saw my doctor and they said this. And it's like, yeah, but Sue has a lot more to offer, like actual things that you can do versus just like, oh yeah, just wait, keep doing your thing.
Plugging away.
So you have a ton of services too that you provide too, but a lot of them are consulting to some manner, right? About like lifestyle and, like you said, making sure that you're making the right choices so that you're at least prepping yourself and your body to be successful. To pan off your question, you had asked like, what's your favorite population? I'd say with that, what are some populations that might not know that they need to see you, but should see you? I don't know if that makes sense or if it feels like a different question.
What popped into my thought first on that was patients that are feeling like they're at their fertility center, their OB, wherever they are receiving their fertility care, and they're feeling like a number. They have questions that aren't getting answered. They don't understand, what does endometriosis have to do with this, or why this, or I could do this or this or this, but I don't know, what do all these things mean? Just patients that aren't feeling like they're able to ask. Some patients are like, I don't want to be one of those kind of patients. And there's just so much education to help people make decisions that, and I know I've worked in fertility centers, it's very quick paced. And that's part of my mission in doing this is I completely support the in vitro world, 100%. And is there a way to help patients not have to go that route because they could have done something else when they were younger or before they got to that point, just educating. And it could be, you know what, your situation is blank. You need to go right to IVF. Makes total sense. And let me help you find
And
places
you're in
that you
that
can go.
position to help people with that.
To help
Like,
guide them. Yeah.
Go do this now.
But even during IVF, you're able to help them too.
Right.
Administer whatever
Yeah.
they need to.
Yep.
So you
Works
can-
hand in hand with
I mean,
their fertility center.
That's the cool thing is you can just be a guide,
Yeah.
Very
Just
similar to
essentially a
what-
fertility coach.
intelligent guide.
The pill gets a bad rap in that when women choose to go off of it and then struggle to get pregnant, they're like, well, it was the pill. I was on the pill for 10 years or I was on it for X. And really what the pill is doing, just like testosterone replacement, it's synthetic. It's running your body off of outside hormones, not your own. You go off the pill, your body's going to start doing whatever it naturally is going to do. We still lose our eggs at the same rate, whether we're on the pill or we're not on the pill. If the pill actually, a myth out there is I'm not ovulating, so therefore I'm not losing any eggs. But if that were true, and these women that are on 10 or more years, they wouldn't hit menopause for another 10 or more years beyond the average 51-year-old.
That's the trigger for menopause,
And-
the egg count.
Yes, when we run out of eggs, that's when we're in menopause.
Yeah, it's like a
It is
cloak.
beneficial in some ways, but most importantly, the patient should be told why they're being prescribed the pill.
Yeah.
And not just, oh, you have heavy periods. Oh, you have irregular periods. Oh, you have blank. Go on this.
Yep.
That they should know these are signs of blank and choose this, don't choose this, pros and cons, your choice.
Most cases, will it spike up your estrogen levels and everything that's been toned down? Does it kind of kick into overdrive?
It
You
should.
find? Should.
Yeah.
Yeah.
It should if you're a regular ovulating woman.
Sure.
Yes.
Sure.
The pill is super fast out of your system. Otherwise, why would women get pregnant if they miss a pill? Or why do we spot if we
true.
miss a pill?
a good
It's
point.
very quick. But that 3 months gives you time to figure out what's my pattern. Am I ovulating regularly? Should I have evaluation? Am I getting a period? What's happening? And then do you see that acne come back? You're not having the suppression of certain other hormones that are good for acne suppression. So.
Nutritional wise, and once again, every case is different. I get that. But nutritional wise for females to normalize, estrogen and just overall function of our body, have you found success with certain supplements, certain foods? Obviously, removing those environmental toxins, whatever it may be, is a huge component. But have you noticed what can they add into diet or more of? You said vegetables, fruits, like all those,
Yeah.
but anything else?
All the antioxidants, just eating clean, organic when you can, wash the pesticides off your fruits and veggies
Wash
if
your
you can.
pesticides.
Yes, wash pesticides. Those are bad. Very bad.
Yeah,
Which
are
is
there
just kinda-
any fun apps that you use with your clients? I know there's like Flow app.
Aunt Flo?
Like,
My
like
wife
Progressive
uses
Insurance?
No, Flow to track like ovulation window. Like
There are all kinds of those apps
Do you have your
for
favorite?
tracking. I'm not really a fan of them.
we're looking for a
because
sponsorship.
all it is
Please, somebody.
data in, data out.
Yeah.
It's just looking at a calendar and saying, okay, so you had a 27-day cycle, you had a 35-day cycle, you had a 30, whatever it is, and it averages all that out.
So it's just a
It's not telling you what is your body doing. It's not predicting a hormone.
I have a question.
I have that
let,
app.
let
Sorry.
Richie talk.
Let's talk more
You
about
talk
Dr. Zach's
because I got
apps.
you got it. You
It
got it.
sounds like
Go,
it's
go.
important.
It's
No,
there.
it's
It's not
Richie's
important.
podcast. It's
Trying to
fine.
get some sponsorship.
I'm trying to bring it. I'm trying to bring it around to I think a question that we haven't touched on yet, or some content we haven't touched on. The emotional component of all of this, right? We've kind of circled around it a little bit, but I mean, how would you, like, I don't know. I'm just leading in, like, what kind of things do you see from couples, from individuals, men and women differently? Like, what are some of those kind of common emotional themes that you help coach people through?
Yeah, there is a lot of emotional component to this. A lot of blame, self-blame, guilt. It's hard to see for that because people didn't put themselves in this situation oftentimes. And the common thought is, well, her periods are off, so it's her fault. It's not me. I'm fine.
It's definitely her fault. Yep.
And there's so much blame on the female. And so the female goes through all this workup before he's even had a semen analysis. And then all of a sudden it's like,
Sorry.
oh,
Patriarchy.
yeah. So there's a lot of that. If the couple is on the same page, then it's so much easier with that. Whether it is, fertility, third is male factor, third is female factor, third is unexplained or combination. So it's not one or the other oftentimes. And so there is a lot of that discordance because of that. Or there's you're telling me we have to have sex again? I don't want to. I don't have patience. I don't even like you right now. And here we have to. And
that's a weird thing. I remember being like, this sounds great from the outside. Oh yeah. But then it's like, I don't like you. Yeah. That's
You can get
really good
transactional
point.
pretty quickly.
Yeah.
you didn't even take out the trash.
Right.
And now you want to have sex.
Right.
Yes.
So there's a lot of, but not always true.
Yeah.
There's a lot of performance anxiety for guys because, in fairness, women can just be like, are you done yet?
Right.
Oh man.
And he's like, I'm
terrifying.
trying.
mashing it.
I can't.
Yeah.
So that contributes to a lot of the emotional issues and
But there's ways around that too, right?
Yeah.
There's some sperm sampling and turkey baster options. Is that?
there are those options. Yeah.
Is that the medical term?
Yeah.
Yeah. Yeah. Home insemination,
Yeah.
clinic
There's
insemination.
kits you can buy, right?
There are kits that you can buy that you can just do it at home.
Yeah.
Yeah, there are ways around it, and it's a myth that you need to have sex every day or twice a day or more than that. Sperm again live 2 to 5 days in the female
2 days.
reproductive tract. So space it out. If you want to go back-to-back days, fine. And if you want to go every 2 or 3, fine. Don't stress out as
Yeah.
much if you can stagger that a little bit more. This is supposed to be fun and
Yeah.
Yeah. Just wait
Together.
till the kid comes, guys.
Yeah. You have to be a guru of non-judgmental approach. Good for you.
Yeah. Who do you judge? No.
myself.
Yeah.
Yeah.
Good time.
A lot of self blame here.
Yeah.
Yeah, we all come in with a different story.
Yeah.
We
Yeah,
all come in with
for sure.
different cultural stories.
We have the same goal.
And
Yeah.
So you
Yeah,
just kind of
that's true.
focus on the goal.
Yeah.
oftentimes,
Just
not
make-
always.
just making
Sometimes
babies.
just one wants the child and the other one doesn't.
Oh, yeah.
And that comes into play. And yeah, it's a big tangled web that we all just need to work together and find the best options for these patients.
Yeah.
And
It's so funny. It's like
do the workup and
there's so much complications and it's so complex, but it's also something that we all have in common in the world. It's like I remember when we had our kid, I was like, well, I'm now part of the biggest club in the world.
Parents.
Is
there, I mean, this is more of a admin type of thing, but you're going to be in our space working. Like, do we have like a hot list of things like services that you can provide and maybe state? And we can, I think that's important because even for me, I am unaware of all the things that you can do and you want to do in your practice. But
What are like
what would you like people to know
priority
you do?
5? Yeah.
yeah. So initial consult. Tell me your story. Where have you been? Where do you want to go? How can I help get you there?
You're like a journalist.
Should we? Maybe. Yeah.
Here's the story.
Can I borrow your microphones?
Yeah.
That'd be great. Is that in my contract?
No,
Okay.
but we're cool. We can do that. Okay.
But just to see what are their goals. How can I help with those? Should we do diagnostic workup? Let's just test and see.
So initial
And then
consults like a
initial
30-minute
consult.
type of deal, or what's your?
They can be an hour.
Okay.
I'm happy to spend plenty of time, go through all of that. And then there's the follow-up. If we do testing, what are the lab results? What's the semen analysis result?
Can you go through the mechanics of that? Like what? So if you decide that the patients are, green lights to work with them, let's start with the analysis. What does that look like? Is that a take-home type
It
of
is.
deal?
Yep. So the semen analysis kit is made by Fellow, and that is the first CLIA certified, or that's documented as reliable as an in-clinic semen analysis done in the privacy of their home on their own schedule. They will buy the kit from me. They'll go home, collect whenever they set it up for themselves. They ship it off, and the next day we have results.
Oh, really?
So
Do you want me to tell you how that, like the in-home process works?
Nope, I got a good idea.
Okay.
Candles and,
yeah, so that's the start for the male.
Okay.
And then if things don't look normal on the results, or if he's reporting libido issues, erectile dysfunction, other things, I can order a hormone panel and look at that, treat that. And then for women, it would be hormone panel as well. And
that's blood draw?
Blood draw, yep.
Is that
And
like a
then
full draw or a finger prick?
It's a full draw.
Okay. And
Full
are
draw?
you going to be doing that?
Yep.
You got your centrifuge yet?
Not yet. It's coming.
Can't wait.
It's coming. And then also I'll be doing ultrasound.
Okay.
So can look at ovaries and uterus and see if things look structurally.
A male exam, what is that intended for?
So that is the physical exam. Is there anything thyroid, chest, abdomen, and then anything structural like not feeling vas deferens or feeling what's called a varicocele, varicose vein in the scrotum, very common issue with fertility. Assessing, is there one or is there not?
Yeah.
Or is there two?
So you have the consult and then the follow-ups. What other
Follow up
things?
and then start some Clomid, some letrozole, try to get ovulation to happen if it's not.
And those are injections you're talking about?
those are pills.
Pills. And you talked
Yep.
about injections too, right? You can.
Injections would be helping out a patient that's going through an in vitro cycle, that some just need help with an intramuscular shot or their sub-Q shots, whatever it might be.
Yeah.
I can help do those as well.
Sweet. Any other things?
Consults for fertility preservation, whether LGBTQ, whether it's in transitioning process, whether it's a pre-cancer treatment, should I freeze anything? So things along those lines.
Because of chemo and whatnot.
Chemo and radiation.
And that
yeah.
can that for females that disrupts cycles and things, I
Both.
suppose.
Yeah,
And
both.
males that probably.
Yeah, we're born with all the eggs we're ever going to have. So anything we expose our body to is impacting our eggs. So
How does fertility and reproductive health tie in with chiropractic?
Yeah, kind of depends. I mean, personally, we talked about my one patient who was like having low back pain and he couldn't perform because of it. I mean, that's something. He came in after he got adjusted. He's like, I had some really good sex. And I'm like, TMI, but good job. So I mean, there's some of that. But I think the nervous system where it plugs in, like getting your spine checked and getting things moving properly, can be a factor. It's a stress point too.
It's a stress point.
Physical stress point.
If you can just take off that physical stress, your body's going to be able to get into that rest and digest, which ultimately affects your
And reproduce.
reproductive health.
Yep.
If you're always on that fight or flight, right,
Yep.
your nervous system is just ramped up. I mean, that's going to affect your body's just not going to focus on trying to produce.
Right.
Right. So that's
fertility is
kind of where,
low on the chain.
yeah, that's
Yeah.
kind of our focus, indirectly making sure that there's not excess stress on your spine, on your body,
Yeah.
so that your body can focus on calming down,
Chilling
Right.
out, making sperms.
just chilling out. So that's it.
Yeah, that's it.
Let's touch on that. So, well, that concludes episode 10. So that's a wrap.
Wrap on the top.
Wrap on the
Tap.
tap.
Wrap on a tap.
This is a house of learned doctors. You're not a doctor.